So I'm Dr. Nancy Georgekutty. I'm one of the primary care doctors and have been with Methodist for more than 10 years now. So my practice is in Mansfield, right off of Debbie Lane. So it's 1601 East Debbie Lane, Mansfield, Texas. And I love working for Methodist and Mansfield.
Okay, great. So the topic for this month in July is about having a primary physician. And so just to I'm just going to throw it out there, and let's just talk about why it's important to have one.
So having a primary care doctor is just really important. So I've got 4 C's for why you should have a primary care doctor.
Okay.
And it's a great memory too.
Okay.
So the first C is for creating a relationship with the primary care doctor. Your second is communicate with your primary care doctor. You want to have sort of a better level of communication to be able to sort of communicate any medical conditions you might have.
Okay.
The third C is catching any preventative medical conditions that you might have that you might not know that you have. And then the fourth one is getting control over chronic conditions you might have.
Okay, so delve into those a little bit for me on each one of those.
Sure. So like for the first one, in which you want to create a rapport or create a relationship, a lot of people out there don't even utilize their insurance that they have. They don't even realize that, once a year you get a free physical.
Right.
You could go see your doctor and create or start to create that rapport or that relationship so that your doctor knows who you are, what your family history is, what your medical conditions might be in the background, and then sort of help you sort of gauge what your health is going to be like as you get older. And also based on your family history, we can sort of create that sort of preventative aspect as well.
Right. Okay.
The second one being communicate.
Yeah.
So the more times you go see your primary care doctor, the better level of communication you're going to have. On the first,
you get more comfortable.
That's absolutely right. So on the first visit, you may not feel comfortable enough to kind of talk about things that are going on.
Mm-hmm.
But by the second or third visit, the more times you're going there, you're going to be able to communicate better and better with your primary care doctor. And you'll feel so comfortable that at that point, you're going to be able to talk about anything from anxiety to depression to chest pains to headaches to maybe even like erectile dysfunction. And so you'll feel so much more comfortable to be able to communicate those things.
Okay.
And then the third thing with catching medical conditions. A lot of people are out there walking around not knowing that they might have diabetes, that they might have high blood pressure, maybe even an underlying heart condition. Those things are really important when you go and see your primary care doctor. They can try to catch those things early and be preventative. So you're being preventative, the doctor's being preventative about sort of preventing chronic conditions later on in the future and complications as well. So this is a really good way of being able to catch medical conditions or be able to sort of prevent things from happening in the future.
Okay.
And then that last one with controlling chronic conditions. So a lot of people out there have diabetes, but they're not sure how to control it. Or they've got high blood pressure and they're having headaches, but they're not sure how they can control those things. And so trying to get control over those chronic conditions, that's really important when you have a primary care doctor. So that's why you need the help of a primary care doctor. There are a lot of new medications out there. There are a lot of old medications out there that might be helpful for patients so that we can get control over those chronic conditions.
Well, and I always felt like having a primary care gives you somebody who is looking at the big picture for you. That is, because a lot of times you'll go to this doctor, you'll go to that one for different conditions, right? And I'm going to say, you are my primary. So full disclosure, but I know that that's been a big benefit for me is that somebody is looking at the whole total picture, because if you're just going to one over here for this and one over here for that, well, they're not seeing the whole. They're just operating in their specialty. So to me, having somebody who manages that for you.
Absolutely.
Yeah.
It's just like you said, when you go to each specialist, they have their own niche.
Yeah.
So they're sort of playing their role in that niche and helping you with that certain condition.
Right.
But the primary care doctor is like the quarterback.
Yes.
For the Dallas Cowboys,
Yeah.
right? So at that point, the quarterback controls the team members, right?
Yeah.
And sort of understands what each team member's position, what their
Right.
role is, and then brings it all together.
Yes.
So that the primary care doctor gets all the information from everybody else, puts it together, and makes this one beautiful big
Yes.
picture. Yeah.
Yeah. I think that's probably, to me, that's a huge. Now, how does someone go about either, finding one, deciding all of that?
So I will tell you, most health insurances
Mhm.
nowadays, they've got a long list of primary care doctors. So you can choose
Okay.
from either family medicine doctors, which kind of take care of everyone in your family, from little kids, from children, newborns, all the way up into however long we can
Mhm.
live, right? There's internal medicine doctors, which can act as primary care doctors, and they mostly take care of adults. So anywhere between 17 to 18 and above. And so your insurance can tell you who's available and who's covered under your insurance. But a lot of times, if you like somebody that you see reviews on, and so this day and age with customer satisfaction and client satisfaction, there are reviews always online, and so you can always go online and you can always call the doctor's office and just find out, hey, do you take this insurance? And a lot of doctor's offices already have a list of all the insurances that are covered, and they can tell you if they're available or not.
Well, the other thing that I didn't, and I don't, I guess as you get older, you begin to go to the doctor more, so you learn these things. But that doctors are within a system too.
Oh.
So it makes it easier if you stay within a system because all the information is shared, which I never really kind of thought about that or realized that, but that's a huge benefit.
Oh, absolutely. When you go to the ER for some reason, or if you have to go see a specialist that's within the system, it's nice within Methodist. We have all of our specialists and our ER visits, our hospital follow-ups, everything's all within one electronic medical record system.
Yeah.
So it makes it so easy. So even if a primary care doctor didn't realize you had gone to the ER, but you were following up, they can easily look in the computer and be able to see all that information.
Yeah. Which gives you that management of
the person as a whole. Yes, absolutely. So managing that person as a whole, and maybe if something was not discussed with the patient, you have the opportunity to sort of discuss that with the patient. So the primary care doctor has that opportunity there. So it's great.
Well, and really, as a primary care, you can almost be the advocate for that person.
Oh, absolutely.
Right?
Absolutely.
So, I mean, that's, to me, that is the value.
Oh, absolutely. So during COVID, I can give you examples where, I worked very closely with the hospitalists, with the doctors in the hospital, since I don't go to the hospital, but I have such a close relationship with the doctors in the hospital at Methodist, that they sort of kept me up to date with what was going on with some of my patients who were admitted in with COVID. And so I was playing as medical advocate, and they were giving me information, and I was able to relay that to their families who wasn't able to go see them. So it was great in that regard. So you were absolutely right. I mean, I get to play that medical advocate besides for being their primary care doctor. So it's excellent in that regard.
Well, and that just builds that relationship.
Absolutely.
Which is like what you said in the very beginning, that's the important piece. Having someone that you can trust and depend on to help you. So.
Absolutely.
Anything else you want to add?
I don't think I have anything else to add, Lori.
Okay.
I think painting that picture of having a primary care doctor and being able to look at a person as a whole big picture and being able to be that quarterback that can sort of manage their health, keep them from getting any chronic medical conditions, and being preventative about medical conditions, I think that's the most important thing.
I do too. Thank you so much.
You're welcome.
Okay.